I'm Dr. Isaac Wornom here at Richmond Plastic Surgeons, and I'm here with my patient Tara, who came to see me back in earlier this year, much earlier this year, for hair loss, which is one of the things we treat here at Richmond Plastic Surgeons. You might find it interesting that there's a bald guy talking to you about hair loss. I told Tara when she came to see me that if we had the techniques that we have now for this problem when I was a young man, I would have sought this out. Tara was bothered by loss that came from her family on the top of her head and in the front of her scalp. And we discussed options such as platelet-rich plasma injection, which is kind of like a fertilizer for your hair that we do here in the office, or a technique called NeoGraft, which is what she had. And this technique involves harvesting individual hair follicles from the back of the head, where most of us who have lost our hair still have a lot of hair. And 1 out of every 10 or 15 of these follicles is taken out and then individually transplanted to where the hair is thin. And that's what Tara had done about 6 months ago.
About 6 months ago, yep.
Could you talk a little bit about what your experience was like here having that done?
My experience having it done was phenomenal. I wanted to come in here today just to make sure that other women know that this is an option that they can consider for hair loss, because I wasn't aware that it was an option. I thought we were going to be talking about the PRP or some other treatments perhaps, but it was actually a really easy procedure. It was just local anesthetic, and it took a few hours. And
took the whole day.
Yeah, almost,
much.
yep. And
yeah.
The first couple of weeks of recovery were like week and a half. Were pretty miserable, but beyond that, it was easy. And now I feel like I'm already seeing the benefits from where I was to where I am now, and I just can't wait till it grows in even more.
Yeah, so I know when we first put the little hairs in you, because we cut the back of your head,
Yes.
the hair down to where they're very short.
Yes.
Yes,
it was about 8 inches by 3 inches from the back of my hair. I actually went to my stylist ahead of time, and she helped with positioning that on the back of my hair, of course, with your instructions.
Yeah, I told you to go see your hairdresser, so we didn't cut your hair.
Yeah, and so we covered it. We got a hairstyle that would cover it as it's growing back in. So it really, I mean, unless there was a big breeze, it wasn't noticeable.
That's all come back, right?
It has.
It's like you haven't had anything done where we take it from.
Yep.
And then, so that's the morning, we spend that harvesting 1 out of every 10 to 15 hairs on the back of your head. I think Tara had 1,700 little grafts taken out from the back of her head. And then you had lunch, right?
Yes.
And then we spent the afternoon putting these individual little hairs where she was thin on the top. And what happened after we put them in? Tell us about how that played out.
Afterwards, I guess I left the original bandage on for a couple of days. And, of course, since it was local anesthetic, I guess there was a lot of, I don't know the right word, a lot of, oozing or.
Yeah, there's a few days where it's kind of messy.
Right.
But you just have to protect them. We teach you how to do that.
Exactly. And it really was just a couple of days of that. And then, of course, I'm trying not to touch the top of my head because I don't want to mess them up or knock any of them out.
Yeah, for about 2 weeks, you have to be really careful.
Very careful.
But then they become part of you. They become your hair. They were your hair, were in the back, and then they become your hair on top. The reason this works in a man like me, like it's interesting how I lost my hair on top but did not lose it in the back, is these hair follicles up here that fell out are sensitive to testosterone, and the ones on the back are not. So when you transplant hair from the back of your head to where you've lost it, that the follicles carry this testosterone resistance, and they live. They don't fall out in the new location. That's why it works.
And they tend to be a little bit darker, not quite turning white yet.
Right, right, yeah. And so the little hairs fall out at about a month,
They did. They
and
did.
and that's expected. They're still alive, but the hair falls out. And then starting what, about 3-4 months afterwards, they start to
Exactly.
grow, and
They- uh-huh.
they're in the getting thicker grow back stage now.
And they're all interspersed in the top of my scalp.
Very natural, very
And
natural.
up to the edge of the
Yeah.
hairline. If you were to touch it, you can probably feel a little bit of spikies, maybe, of new ones that are growing in.
Mhm.
But I definitely can see the difference when I look myself, even at just 6 months, that it's a lot thicker here. I
Yeah,
don't
did you tell
see
me your
scalp.
hairdresser noticed it?
Yes, yes, my hairdresser has commented, and she actually was the one to let me know that so many women actually are experiencing this, and she was really excited to be part of it and kind of looped into what we were doing, so she could pass that information along to others.
Well, do you have anything else to share about it? Because I look forward to seeing you in another 6 months to a year where we see the absolute final result where it's completely regrown. But I think it
Right.
looks great now.
This was absolutely the best choice for me. I definitely had a family history of the form of alopecia, and I think that I've at least pushed that back a few more years in my life. So I would really recommend it to absolutely anyone.
Thank you for coming today.
Thanks for having me.